work with your immune system so that your body will be ready to fight the virus if you are exposed. Very similar to the flu shot that many of us get. So it doesn't eliminate you from getting the virus, but it helps you fight off the virus, greatly reducing hospitalization and death. So remember, even after being vaccinated, we need to continue our own personal accountability. So wearing the mask should be continued. Social distancing should be continued. Getting tested if necessary, and washing our hands all should be maintained until the CDC and other credible agencies tell us that we can kind of relax on that. But that day is not here. Together, COVID-19 vaccination and following the CDC recommendations can protect each and every one of us. So it is recommended that we all get vaccinated as soon as we become eligible. Again, we're moving into 1C, and then soon, very, very quickly after that, everyone over the age of 16 will be eligible to get the vaccine. So we thank you for all the folks on the line have done to fight COVID-19, and we ask that you keep up the hard work during this critical turning point of the pandemic. Thank you very much. That concludes my remarks, and I would take any questions that anyone has.
Thank you, David.
You're welcome.
Over to you, Ahmed.
Yeah, no, thank you so much, David, for this. I think, we will have a number of questions. I think some of them will ask you to expand on what you have said, and then a few others. But I'd like to bring our next speaker, my colleague, Stephanie Sun. Stephanie Sun is the Executive Director of Pennsylvania Governor's Advisory Commission on Asian Pacific American Affairs. She has had many community-looking events. We had wonderful partnerships, and we are so happy that she was able to join us today, as we wanted to highlight both the COVID-19 aspect, but then a related concern, which is, of course, the very recent unfortunate uptick in anti-Asian hate that targets our broad communities from API backgrounds. Within our Muslim community, we definitely our API Muslim communities are on the receiving end of that as well. Stephanie, thank you for joining us. And if you could tell us a little bit about the governor's administration's position in regard to this recent spew of hate, anti-Asian discrimination and violence. We have had cases across the state, not only in Philadelphia, but in different parts of the state. And what, if anything, has the administration done to address anti-Asian discrimination and violence? What are some ways that you're working with community organizations? So we'll look forward to hearing this from you. Thank you.
Thank you, Ahmed, and thank you, Rabiel. And thanks to my dear colleague, Devi, for the great remarks and updates from the state regarding to the vaccine. And good afternoon, everyone on the line. Good afternoon, distinguished fellow speakers, and good afternoon, dear Muslim brothers and sisters. As Ahmed just mentioned, my name is Stephanie Sun, and I serve as the Executive Director of the Pennsylvania Governor's Advisory Commission on Asian Pacific and American Affairs. It's our great honor to partner with Muslim Aid Initiative, Pennsylvania Department of Health, Einstein Health Care Philadelphia chapter, and multiple great organizations to co-host this webinar. On behalf of Governor Tom Wolf, I want to express our gratitude to all of your hard work and effort during this pandemic. And I especially want to thank the Muslim Aid Initiative, an young organization fantastically founded just 1 year ago, specifically to help the community fight the pandemic. Thank you so much. And thanks to the question. To answer the question, first I want to say Pennsylvania was originally founded as the Secretary of Religious Freedom and Tolerance. And throughout the whole history of Pennsylvania, the Commonwealth has been the leader in acceptance and tolerance of all people, no matter their beliefs or religion. there is no place for hatred and bigotry in the Commonwealth of Pennsylvania. As Governor Wolf recently said, the Asian and Asian American community is a valued and valuable part of the Pennsylvania community. Any attack, whether verbal or physical, on an individual of Asian descent because of who they are is attacked on all of us. This cannot and will not be tolerated. I encourage all Pennsylvanians to support our friends and neighbors in the Asian and Asian American community during this difficult time, and demonstrated that those with hatred in their hearts constitute a specific and very significant minority of the population. Pennsylvania stands in support of the Asian and Asian American community. On February 22nd, my commission, the Pennsylvania Governor's Advisory Commission on Asian Pacific and American Affairs, issued a statement strongly commending racial violence against Asian Pacific Americans, which was translated to 12 Asian languages. After Georgia shooting on March 19th, together with the Governor Wolf and 4 other Pennsylvania commissions, we issued a joint statement in remembrance of lives lost and commending Asian and Asian American hate. Starting from the early morning right after the Georgia shooting, in the span of 10 days, we worked with Governor Wolf on pushing out 4 special messages through his social media on Stop Asian Hate. On March 26th, the Stop Asian Hate Virtual National Day of Action and Healing, Governor Wolf, together with 25 governors, signed onto a letter condemning anti-Asian acts of hate. On March 24th, our commissioner, along with State Representative Patty Kim, held a preference conference together with her fellow state representatives in response to the Georgia shooting to show the solidarity with the Asian Pacific American community and support the anti-Asian legislation. After the Georgia shooting, the Governor's Commission on Asian Pacific and American Affairs co-organized 2 vigils in memory the Atlanta victims and commending anti-Asian hate with local community and governments in Western PA and Central PA, which engaged more than 3,800 people in person and virtually. And tomorrow at 2 p.m., we will have our Eastern PA vigil in Montgomery County, which is the county in Pennsylvania with the largest Asian population in the terms of percentage. We co-organize it with the group of passionate Asian Pacific American local residents from various industries. You're welcome to join us in person if you're in the region or virtually throughout the live stream on our Facebook page. In the past several weeks, we have been collaborating with diverse organizations in various regions across PA. More than 10 virtual town halls and panel discussions, and multiple in-person rallies, and having numerous meetings on anti-Asian discrimination and violence. Including this one, we're having 4 events in the coming 10 days, engaging diverse communities and stakeholders. Besides working with community and government agencies to address this issue, we also try to promote the racial equity and exclusiveness through the culture and education approach, promoting the positive acceptance of the Asian Pacific American community through schools, teachers, and students. Our commission has been creating Asian Pacific culture educational resources package for schools and educationers, starting with the Lunar New Year, which was celebrated by more than half of the API residents in Pennsylvania. Our Lunar New Year educational resource package has been spread to multiple school districts, schools, educational agencies in different regions of Pennsylvania, and utilized in classes and educational activities during the festival seasons. We received very positive feedback, and we will continue producing educational resource packages for major Asian Pacific American festivals and events, and providing them to schools and educational and cultural programs in Pennsylvania. Now we're working on the educational resource package for the Asian Pacific American Heritage Month, which will be coming soon in May. In addition, our commission is also working on 2 other new projects to address the anti-Asian hate crimes and discrimination. One is to set up a Pennsylvania anti-Asian hate crimes and discrimination database, collaborating with our community partners by collecting data and stories from the community, providing resources, and producing periodically reports for the government agencies and the communities. We hope to utilize these reports and data to work on structural reform, resource equity, and accessibility. The other new project is to build a statewide directory of resource government agencies and community organizations providing services and support on combating hate crime and discrimination. We will share the directory with everyone. For social justice and humanity, we encourage victims of racial violence and discrimination to speak out, to report, and call for all Pennsylvanians to stand up against anti-Asian hate and racism in all forms. Hate has no place in Pennsylvania. Thank you.
Absolutely, yes. Stephanie, thank you so much for your remark. And diversity is a strength, not weakness. We need to understand that, and we are in 2021. So with that, I'm going to go to Congresswoman Scanlon. Such an honor to have you here today, especially because you represent not just Delaware County, also parts of Chester County, Montgomery County, as well as Philadelphia County. Would appreciate if you could share some insights on what your office is doing in terms of whether vaccinating people and building that herd immunity, as well as the hesitancy among minority community, especially around people of color. And also if you could share some insight in terms of benefits for people who have lost their job, as well as small businesses that are not able to survive.
Certainly. Well, thank you for having me here, and thank you to the Muslim Aid Society, the CARE, our Commonwealth allies, and everyone who's participating. It's obviously been quite a year, but we're very excited, first of all, for the rescue package that was just passed towards the end of last month, because that continues many of the good things that we were able to get done under the prior administration, then expands on some as well. So this most recent, the March COVID relief plan included a 3rd round of stimulus checks. And those checks are still going out, and they're going out as paper, they're going out as debit cards. There's a variety of ways that they're going out. But if you didn't receive the full payment on the 1st or 2nd round, you still can get that when you file your 2020 taxes. There's a line where you can claim that. And then as I said, the 3rd round of checks is still going out. If you have specific questions, please contact our office. If you're a constituent, you can reach my office through our website, which is scanlon.house.gov, and there's a space that constituents can send an email, or you can call 610-626-2020. And often the questions are going to vary a little bit depending on people's individual circumstances. But so there are those stimulus checks, and we're on the 3rd round of them. The pandemic unemployment insurance was reauthorized, so that is continuing. under the most recent round. There was an extension made to the small business payments, the PPP payments. So those are still eligible to be applied for. And for the first time, we were able to get specific money in for restaurants and for entertainment venues, which had kind of been passed over earlier. This most recent plan finally sent money to our state and local governments, which had been a big sticking point, but we know that those agencies have really been on the front line of the pandemic response. So that's going to help them not only keep sustaining testing and vaccination and such, but also keep their employees employed, which was an issue for many of those places that had to start doing layoffs. There are some really important additional things in there. There's additional money for childcare, and there's a child tax credit increase, which is really the expansion of the child tax credit, maybe one of the most important things we've seen come through our government in a long time. So this provides folks below a certain income that they can get, it's called a tax credit, but you don't have to pay that much in taxes. You don't even have to pay taxes, you know, if you don't earn enough in order to get this. And for children under 6, it's $3,600 a year. And for children under 17, between 6 and 17, it's $3,000 a year. And this is a recognition of the fact that children are expensive. I have 3, I know. But this is supposed to help people keep food on the table, get the kids into good childcare, along with these other benefits, which is the difference for many families in whether or not the parents are able to go to work. So lots of new benefits there. We've been posting information on our website, and there's great information out there, particularly if you're interested in the child provisions from pccy.org, Philadelphia Citizens for Children and Youth. So there's some really important stuff there. Those payments are supposed to come through on a monthly or bi-monthly basis to families. And so that helps people ease out their budgets, you know, rather than getting one refund at the end of the year, and, you know, who knows what that goes for. To be able to get these payments staged over the course of the year makes it a lot easier for families to plan. So that's a really important piece that came through. Now that's only good for this year, but we're hoping to make that permanent because it is a really important support service. And then there was a lot more done with respect to food, because we know our region, Philadelphia, is the poorest of our large cities. And under pre-COVID times, we had a lot of, it's called food insecurity, but people were hungry. Families were hungry and children were hungry. So we've been able to get additional SNAP benefits, more flexibility with respect to those benefits, and re-upping some of these food boxes and other programs that are making sure people stay fed. So those have been major focuses for my office throughout, trying to make sure that people have the basic things they need. Oh, I'm sorry, other things that came through: extension of the eviction moratorium through the CDC, as well as additional money to help with rent payments and mortgage payments so that people can stay in their homes. Basically trying to keep people in place, able to keep their heads above water until we can get to the other side of this. Going forward, of course, there's a push to have a big jobs bill, infrastructure bill, that will enable us to kind of build our way out of this, but in a way that looks towards the future as opposed to the past. So investing in green energy as opposed to, you know, reviving, say, defunct coal mines or something like that. Especially paying attention to things like our schools. We know in Philadelphia, there's about $5 billion in school maintenance that needs to be done. So lots of work to come. But the attitude and the feeling right now is that we're talking about basically a new deal for the 21st century, and needing to transform the way we do business in this country, and look to the future as opposed to trying to rebuild the past. Now, with respect to vaccination, I mean, obviously it's been kind of a rocky rollout, in part because we had to create the vaccines first. And, you know, it's a real testament to American science and ingenuity that we now have 3 highly effective, safe vaccines that are moving out there: the Moderna, the Pfizer, and the Johnson & Johnson. And production is ramping up. The rollout has been rocky, in part because the prior administration focused on getting the vaccines, which was great, but then didn't have a plan for distribution. Also didn't have a federal plan for how we needed to respond, the federal plan for testing. we're moving in that way now. But it has, our region sits at the junction of Philadelphia, which has one system for vaccination, the surrounding counties, but then we've got New Jersey and Delaware. So everyone has slightly different systems, and it does get confusing. But what we're seeing is, particularly the last few weeks, as more vaccine comes in, it is getting easier. We've had the collar counties have had some disputes with the state about whether we've gotten the proper amount of vaccinations, but they're trying to right size that. And while those adjustments are being made, my office has been focused on trying to get more doses from the feds, as opposed to having to fight with other people about what's coming from the state. So we've been able to have some success there. We've gotten some of our federally qualified health centers, FQHCs, and ChestPen is the one in the primary one in Delaware County. So those are health centers in already under-resourced communities, and they're getting extra doses directly from the federal government. We also looked at where there were vaccines available across PA5. And by the way, I don't have any of Chester County. That's over in Chrissy Houlihan's district. But I do have a little bit of Montgomery County, and then South and Southwest Philadelphia in addition to Delaware County. So we looked at the map of where vaccines were and tried to identify some areas that there were gaps. And then we went to Rite Aid, which is one of the federally supplied pharmacies, and said, there are gaps here and here, can you help us out? And so they brought us another 1,000 doses. We did some pop-up clinics at churches in Darby and Eastwick, and then we had one with Widener that tapped into the Chester area, and we're hoping to continue doing that while we see these rollouts going on. So, it's getting better. I'm hearing in the last week that people are starting to get multiple phone calls from the different places they've registered. Just today, it was very exciting for me personally because my husband finally became eligible to get a shot. And so we were able to go to a clinic that was being run by Springfield Pharmacy, which has been doing amazing work in Delaware County. And I think I saw it on Rabul's page, advertised the Springfield Pharmacy clinic that happened at DCIU today. And, volunteers come out, they volunteer their time to help people get vaccinated. It is probably about the happiest socially distanced thing we can do these days. So I highly recommend it. As a member of Congress, they vaccinated members of Congress and the Supreme Court as soon as the vaccines came out as part of a national security initiative so the government could keep running and so that we didn't all get it. So I got vaccinated 2.5 months ago, totally fine. I was one of the 30%, I think is the figure, of people who after the second vaccine feel a little bit like they had the flu. So I had a little bit of fever, I had some chills. It was 24 hours of not feeling great, but I'm informed that now I'm completely invincible and may even have superpowers. So I do highly recommend it. I mean, it's so much better than the alternative. We know the mortality rate and the long-term effects of having COVID are quite serious. So, a little discomfort for 24 hours is definitely worth it. I highly recommend it. And then as Stephanie said, I mean, the federal government now, as the state government is trying to support our Asian American Pacific communities. In the week after the Atlanta shooting, there was a congressional hearing on AAPI hate and how that's connected to the COVID pandemic, and the fact that there's been a lot of really irresponsible rhetoric from some of our leaders. The good news is that we are turning a page on that. We've had 4 years where hate rhetoric was not only not challenged, but in some ways enabled. And it's going to take some time to, put all that stuff back in Pandora's box, but we are trying to do what we can at the federal level. Just this week, I believe, there's a bipartisan, bicameral bill that's been introduced to address hate crimes and put in stronger protections. But in the meantime, we're just trying to support the community, call it out for what it is, urge people to report it, because we know that historically this kind of hate speech and hate crimes has been underreported. So we are encouraging people to come forward when they experience this kind of hate. And we're just trying to be the best allies we can at this point. So a lot going on, but it's definitely spring. The sun is coming out more. It's not so miserable outside, and we're getting more vaccines. So it feels like things are looking up.
Thank you, Congresswoman, for your great remark, and I look forward to partnership with your office in vaccinating Muslim communities in Greater Philadelphia area. With that, I'm going to go to my partner, Pastor Nate Goodson, who has helped me vaccinate around 1,000 people, right? We had done multiple vaccine clinic together, and I would like to go to him and ask him, both from the religious perspective as well as his community activism side, what is he doing? And also, a lot of people these days use religion as an excuse to not to get the vaccine, right? Why is that? And what are you doing to help that? And also, your contribution for the community.
Thank you, Rabbi Woolley. Thank you, Muslim Aid Initiative, and particularly thank you for those officials that you've been able to bring together for this very, very, very important session. Congresswoman Scanlon has been out here since she became a councilwoman, and I certainly commend you, Lady Scanlon, for the work that you've been doing. You may not remember, but you came to our event, maybe the first year in Upper Darby, where we were doing some things for the Bywood Community Association. So I don't want to take up a lot of time. What I do want to preface my remarks by saying is that I am convinced that faith-based leaders are extremely important in making sure that this vaccine gets into the arms of our people. I am particularly committed to making sure that the vaccine gets into Black and brown people. And that's one of the reasons that Rabuli and I have partnered. I will say to you that we did the vaccine on the last snowstorm, 3 inches of snow, but 300 people came that day to receive the vaccine because it was that important to them. I was very happy to see, because one of the things they're trying to do in the community, because we are a very diverse community made up of African Americans, Latinx, Sikhs, Muslims, and so all of those people came to our facility on that day to receive the vaccine. As I said, on a snow day, we were able to do more than 300. So I think just based upon that, what I'm seeing is that faith-based leaders are extremely important in making sure that this vaccine gets into our community. One, because they're trusted. They're probably one of the most trusted people in our community. And one of the things that I'm seeing, and I'm not going to take up a lot of time because I want to hear what our leaders are saying, but one of the things that I've seen is because we have volunteers in the church, and because the church is and synagogues and mosques are in the community where people trust those leaders, we are better able to touch those people in our community. And I think that the reason that so many people came to us on a snow day was because they trusted us. We made phone calls back, which is one of the issues that we've had, that people will put their names on 4 and 5 sites and no one will call them back. We called people back, even if it was to say to them, we've run out of the vaccine, we'll put your name on a list and we'll call you back. And by the end of the day, we had about 30 vaccines that we were able to get into the community, and we had a list of people that we were able to call. The congratulations, the support that we received from the community, just by virtue of the fact that we were able to return phone calls. I can't tell you how important that is. And so I do want to really push Congressman and Ms. Sun and Mr. Sanders, if you are able to use the faith-based and the faith-based organizations, I know that that will be one of the ways that we can get this into the arms of people even more than we have already done. And we have done a great job. I'm particular to hear Mr. Sanders say that 5.7 million Pennsylvanians have been vaccinated. That's huge. But we're still lacking in our community, in the Black and the brown community. They're still having some trepidation and some challenges for getting there. And a lot of it has to do with having to go to different places to receive it. And if we could set up more of those clinics in our communities, I think that would be great. The last thing, Congressman Scanlon, perhaps you can help us with. I am a part of an organization that's now trying to get the vaccine in Philadelphia. The Black Clergy and Vicinity has partnered with the administration in the Philadelphia, Mayor Kenny and his administration, to get this vaccine into more Philadelphians. I'm concerned that we may not be able to use that initiative for people in the county. And I'm hoping that you perhaps might be able to help me in making sure that the work that I'm doing to make sure that people in Philadelphia get it, that also translates and transfers into here, into the county. Thank you, Rabiel. I'm finished.
Thank you, Pastor Nate.
Thank you, Pastor Nate. Thank you so much to all of you. This is really a good wealth of information, and we'll be going into more particular questions in just a few minutes. But I wanted to bring Dr. Najman Riaz first for a set of questions on mental health. Dr. Najman is a psychiatry specialist, doctor at Thomas Jefferson Health Network. And Dr. Najman, what we wanted to ask you is, what are some of the most recent trends you are seeing in terms of mental health? Are there challenges for those who may be going back to work, school, or may be expected to do that? There are several other aspects of the opening, so to speak, that I think brings for all of us. So if you can shed some light on the trends and some of the particulars of what you are seeing as a mental health specialist in the field.
Brother Emma, thank you for the questions. And again, I so appreciate all you guys' work. I mean, this is awareness, and awareness is really the first step to make all the changes. And listening to all of your amazing work that you're doing and how you're bringing the communities together, removing this concept of bias and hate, and more so even combining science in this with the awareness of the coronavirus and sharing with people what all the steps you guys are taking. I mean, this is really what's going to change us for good. And I am thankful and blessed to be a part of this wonderful crowd. And coming back to your question, Brother Emmett, again, I wish we had good news as behavioral health professionals, even though as optimistic I am myself. Figures don't look that good out there. People have been in this for a very, very long time. Remember the days like soon after the pandemic, we used to reassure each other and say, hey, we are all in this together. This too shall pass. But you know what? It's kind of like we've been sounding now like a broken record because people are really tired of all of this. And I think in spite of the fact that the vaccines are going on, and one of the reasons that the cases may be going up is probably the effect of that fatigue. People do not really care anymore. People want to live their normal lives. Children are enormously struggling. Teenagers are struggling. They have been virtually for such a long time. And remember, we humans can only last on our reserve of resilience and patience for this much. We are human beings at the end of the day. The news out there doesn't look good. So it clearly affects our psychological well-being. I mean, believe it or not, we're either in the beginning of this enormous mental health pandemic, or we're already in it, or we have yet to even hit it, because the numbers don't look good. There is an enormous rise in the level of anxiety. there's an enormous rise in the level of depression. And we're still not clear as to what is happening because folks are not coming out that much as they should be. Yes, there is a lot of awareness, there is education. I mean, I was recently reading in one of the studies, they found that the suicide rates have not gone up, which they think is a good news. And we don't know why, because in the previous Spanish flus and all, the suicide rates were going up. They're thinking that it could be that maybe people are doing a good job with connecting. I think there are lots of connections happening virtually. So we are feeling a part of this bigger group, and that may be why. But here's the bad news. The bad news is that they're saying that maybe there's a chance that the suicide rates could go up down the road. So what they want us behavioral health professionals to do is to be very vigilant, to, offer our services to people out there. And again, raising awareness and monitoring is very, very important, especially in the school age children. I mean, I know that the kids are trying to go back, and I know schools are doing a wonderful job, maintaining the social distance and testing and all. And psychologically, it is a relief for the children. But still, what are the after effects of all of this? We still do not know. I mean, I don't know if you guys, how we say like the PTSD in the military and all. So when people are fighting on the borders or, in other countries, their adrenaline is so up. And that's not when the PTSD hits them. When they come back home and they're all of a sudden in the mall, everything is quiet, they're sitting watching TV with their families, then boom, that's when the anxiety hits. That's when the panic hits. So we are thinking as behavioral health professionals that maybe as this pandemic is going to come down, that is probably when we will be seeing this magnitude of anxiety, depression, the after effects of all of this havoc that the pandemic created with job losses, social isolation, ripping families apart, businesses getting closed. And I mean, there is enormous financial burdens on the healthcare systems to an extent that we're noticing, at least on the Jersey side, the major healthcare systems are kind of like changing gears to maybe, overcome that financial losses. And that does not seem good, unfortunately. So I'm just hoping that, the trend will be good, and hopefully again, this will pass and we will have better days ahead. Not only will we survive this, but we will thrive. And there was one last thing I wanted to add. Brother Emmett, as Pastor Goodson said that, and again, I really thank him for raising this point, because what we are seeing as mental health professionals is in the minorities, this lack of trust on the system, which is rightfully so, because things have been bad. Leaders have not done a good job, unfortunately, over the past few years. And this lack of trust is what is stopping them from coming forward to getting the vaccine. And this would be, again, on the religious organizations, because a lot of them do trust their religious leaders, believe it or not. So combining science with religion, I mean, as a psychiatrist, I would love to see probably maybe a counselor being brought, maybe a doctor being brought in the religious services. I mean, I don't know if it's possible, but if it will be brought so that we can all work together as a team, because unfortunately the minorities are the ones who need it the most. The effects of the virus is the worst on them, not only health-wise, but even financially. So they're the ones who need it the most, and unfortunately they're the ones who are lagging behind. And that is a concern, I mean, just as a mental health professional. But, again, we're optimistic, and with folks like you, things that you're doing, I think we will see some good days. So I'm going to be hopeful.
Thank you, Dr. Najmun, for all the work you're doing, or releasing videos on mental health, how to cope with it during this time of pandemic, as well as Ramadan is nearby, right? Next, I would like to go to Dr. Wani and also to Dave a little bit. Dr. Wani, David slightly touched on the effectiveness of the vaccine. Does this really reduce the hospitalization? And now there might be some confusion in general public like myself. Okay, this vaccine is probably effective for 6 month, right? Pfizer, and also a lot of people are comparing the brand of vaccine. Oh no, I don't want Johnson and Johnson, but I want Pfizer, and the vice versa. Could you please comment on that? Maybe David or Dr. Wani, maybe both of you. You're on mute. Still on mute.
There you go. Raviul, thank you so much for inviting us. I think this by far has been one of the best discussions I've had. Really have enjoyed every single speaker, and from different fields, different experiences. So good. We see this whole process grow. And I'll take that couple of those questions. I think with the vaccines, there's so many myths in the community, as you can imagine, other than the dangerous ones where people think that vaccines are not effective or they're dangerous. Other things like which vaccine is effective out of the three. Now that we have three choices, I tell all my patients, I told myself when I went for the vaccine, I don't mind whichever it is because they're all FDA approved, tested, data has been reviewed by independent, authorities in vaccination, which are medical personnel, and by the FDA. All the groundwork has been done well, and all three have been found to be equally effective. So whatever is available, the first one I would say to all of our audience, just take it because it's very effective. In terms of the data, in terms of complications due to vaccines, as you know, when a vaccine is approved, they look at all the phase 3 studies and trials, and after that, I think the CDC and the FDA and other organizations are actively logging and kind of managing data. They have different ways. There's an app-based device. There's also online, and also kind of following up some of these patients, seeing what is the real world scenario, what's happening to these patients after they get, or these people who are getting the vaccinations. And as of now, I don't think there's any reports of any increased complications due to vaccines other than just the anaphylaxis that was seen in 3 to 4% of the patients in the trials. So for example, you would say hospitalizations, there's limited data at this point of time to say if it has increased hospitalizations, but definitely the COVID hospitalizations are down due to the vaccination. But in terms of the general public, if we compare people who got the vaccine and people who have not gotten the vaccine yet and see what are the rates of hospitalizations or cardiac arrest or stroke or encephalitis or other infections in people unrelated COVID unrelated diseases and complications, there's no statistical difference. So nothing worse has happened because of the vaccine. In fact, more benefit because it's tackled the biggest killer in America right now, which is COVID related deaths. So it has really brought that down. We may have some more data as that's collected, but as of now, there's only 2 published studies. One was done in healthcare workers and first responders, and they saw there was effectiveness of the vaccine in the post-vaccination period was with both the Pfizer and the Moderna was about 90% after the 2 doses, and giving it adequate time. That's one point I want to make too. Adequate time means you get the second dose of vaccine, you wait another week, so you get a total of 28 days or 4 weeks before you say, I'm fully protected. I've seen some people, take that step and kind of prematurely go out venturing and, socializing, thinking that they already got the vaccine. And I can tell you, I saw in the last 3 weeks, 2 sick patients in the ICU, critically sick, who had just gotten the vaccine, the first dose a week before. And because of that, they just felt that comfort. They started, meeting with their family, and one got it from a family member, one got it from a friend, and they were both critically ill. So just trying to reinforce that, wait, give it adequate time, wait 28 days after the first vaccine or 2 weeks after the second dose before you feel comfortable and do things. So those are the kind of things I wanted to mention, but also that you can see, as you all see, when you drive out on the road these days, you see there's a lot of traffic. It's just like pre-COVID, you see the as Najman touched on, and as Dave also mentioned earlier, that people think that, I personally feel that people feel more confident with the vaccination. There's a lot of COVID fatigue, and there's the summer is coming, spring is coming. So, and 1 year has passed, so people feel that they're okay to go out. And now this is towards the tail end of the, the disease. But I would say again that let's not be premature in taking those steps to bring back our life to normalcy. Let's just wait another few months till everyone is vaccinated. Right now, there's about 25% of the American population has been vaccinated, and the number of vaccines available are increasing day by day. The number of people who are getting vaccinated is increasing day by day. So all we have to do is just be patient. If we are vaccinated, just do the right thing. Like Dave mentioned, still do your social distancing because you don't want to infect other people. we wear your mask till all of us, all of the citizens of this country are vaccinated, we have herd immunity, and then we can say, let's wait and see what our, these organizations which have a lot of experience with this, the CDC especially, will tell us. When they tell us take the masks off, we'll take them off. Until then, we should just wait very patiently and do all the best we can is to encourage our community members, the people we interact with on a daily basis, like I can do with my patients, with my co-workers. We have had discussions and we have really helped some of our co-workers even feel confident enough to go to vaccinations who were feeling hesitant about it before. And we can all do our part in the community. We'll get there soon and hope for better times again.
Thank you, Dr. Wani, and would like to hear David's perspective on it as well. But I just want to add one more thing. There is a significant amount of physicians also that don't believe in vaccination. Is there anything that Department of Health, maybe Congresswoman Scanlon, maybe you could jump in? Are you having any closed door meetings or anything with them to kind of mitigate that? And or why is that?
I'll jump in real quick just to say that healthcare workers specifically, maybe not physicians like Dr. Wani, but more so nursing folks, long-term care, living facilities, and nurses that work there. I mean, they're people just like all of us, and they have the same hesitancy, concerns that many in the public have. And I don't think it's as high as we first thought it would be, but they have those concerns. And we have, had some, I wouldn't call them closed door meetings, but we've had conversations with healthcare leaders and, trying to get them to spend the time that it takes to work with their staff. And I've seen incentives. I've seen some organizations providing, $25, $50, gift cards, and making sure that, that the staff are not losing, money, having to come in at different times to get vaccinated. So I think we've done a better job than we were in the beginning. Those numbers have improved, but there's still clearly some work to be done.
And I would just add, it's turning out to be really interesting where the hesitancy is coming from. I mean, early on, we were hearing it was going to be a lot of hesitancy in the African-American community based in part on, bad incidents in our medical past. But in some ways, it feels as though the shortages we've had early on and the fact that there's been such demand has overcome a little bit of that and the fact that we've seen that community hit so hard by COVID. So everybody knows someone who's been hit by COVID. One of my favorite advocates is another pastor, Pastor Wilkinson from Shorter AME over in Morton. Pastor Wilkinson's day job is at Temple, where she does COVID testing. So because of that, she got vaccinated early on. So on the one hand, she sees the really devastating impact of COVID and how many people are getting it. And on the other hand, she got the shot early on. She's fine. She's a big advocate, and she's able to speak from the religious perspective, from the science perspective, et cetera. But the one that's become very odd is the fact that in the center part of the state, where we have a real conservative political realm who bought into some of this, COVID is a hoax kind of stuff. A lot of the white folks out in the middle of the state we're seeing are really hesitant to get the vaccine. And there was just reporting today that the red states are vaccinating at a lower rate than the blue states. So, it's definitely not about the science. It's about the politics and worldviews and distrust of government. But, whatever we can do to show people that it's safe and help them get the vaccine, especially in our densely populated, very parochial region of Pennsylvania, where people don't like to walk 3 blocks because they're in somebody else's neighborhood. So, whatever we can do to partner with people to help get vaccines to people where they are, with people they trust, that's what we're trying to do.
Thank you, Congresswoman Scanlon and Dave, for your remark on it. And it's really interesting how we complain about not getting the vaccine, but when you really have the vaccine, you are saying, "Oh no, I don't want it." I can tell you that from Muslim Aid Initiative, we have released a video in 8 different languages, including English, Bengali, Arabic, French, Spanish, Mandarin, Urdu, and Hindi, to kind of get the message across in those community or community in general. And also on Wednesday at St. Luke's, I had the opportunity to join health secretary for the press conference. We had some very interesting discussion there as well among the vaccine hesitancy among the minority group or people in general. As you heard, God remains, or religion remains a really important topics, and we heard the perspective from Pastor Nate, and I want to go to my co-host, Dr. Ahmed. Time to put your panelist hat on. A question from the Islamic point of view as well. You are also a leader, and Ramadan starts from Tuesday. Is there anything you could share that does the religion of Islam prohibits you from getting the shots, or can you take the shots in Ramadan, the month where we fast, when we fast?
Thank you, Brother Rabiul. And to answer this question, I'm not a religious scholar myself, but I will refer to a recent guidance that National Muslim Task Force on COVID-19 and the National Black Muslim COVID Coalition published. They published a document that details very clearly that a majority of scholars mentioned that Muslims can take the COVID vaccine during Ramadan. There is no concern about that. In these rulings, these scholars will prioritize the legal maxim of preservation of life and looking at also, the scientific aspect and bringing them together. No hesitancy whatsoever to take the vaccine during Ramadan. Even the side effects and all those kind of considerations have been clarified. And I'll ask, everyone to search for that guidance that has, I could just, quickly share screen. That has very good, graphics and explains, this question for Muslims, and then there is guidance for mosques and for Muslim congregations to follow during Ramadan this year, if they are open and if they have been, they are going to hold the nightly prayers and the fast-breaking dinners. Many places are doing carry out boxes or have found different ways to make sure that they are foregrounding community safety. So I hope that helps explain that question.
Yeah, thank you. It definitely does.
Actually, can I just ask, I would love to be able to share that. If we can get that emailed, we can share that. And I know the Pennsylvania Department of Health, we had a conversation with the secretary on Friday, and we learned, I think that on the website, there's already COVID information in 13 or so different languages you can access through the website. And they said they are preparing additional paper, leaflet type information that we'll be able to disseminate to our communities in additional languages. That's not come out yet, but it's in the process of coming out. So if folks are looking for more information, it's there. And I think Montgomery County also has done a pretty good job of putting out information, COVID information in different languages.
No, absolutely, Congresswoman. And then a shout out to one of the local organizations, Muslim Wellness Foundation, who is one of the key founding members of the National Black Muslim COVID Coalition. Who they have worked with the national groups together to produce that guidance. So we'll be sure to send it to your office. So hopefully that can be shared. But I know that we are coming to the end of our time, and we know that as time goes, our audiences also get tired of long Zoom meetings. But there are only some quick questions for Stephanie, and some of this has been shared, Stephanie. But the whole, I guess, what Congresswoman has mentioned, the political aspect of the China virus language and all of this, you're probably seeing some of these impacts in the anti-Asian sort of hate and the spike on that. What are some sort of useful messaging that you and other community members from our allied organizations have been using? And then second is, how do we make sure that some of the double standards that may have happened during the vaccination process or other things, as well as language access for API communities, that can help close some of those gaps and the trust gap, especially. So I know that you've been active in the field. If you can carry a few insights from that, I think that would be very useful for us all.
Thank you. To the first question about the anti-Asian hate, and definitely is our community have been heavily negatively impacted by those misinformation about the cause of the COVID-19, such as those Chinese virus and Kung flu virus. So we have been heard many sad stories from the community throughout the whole pandemic, starting from the very beginning of the pandemic, from 1 year ago, that community members from Asian Pacific American, they have been attacked both verbally and physically under that. So it happened when people were just walking on the street. It happened when people were just standing in line in front of the grocery store. It happened even sadly with students in the school. So one very important message we have been trying our best to setting out repeatedly is please report. And also please speak out, stand out when the things happen. When no matter you are the victim, experience the discrimination or a hate crime, or your witness. When your security is secure, please at least use the most powerful weapon in our hand, which is our cell phone, to shoot a video, to record the audio, and write down the notes of very important information such as location, time, if possible, people's name, and if there's racial slurs or wording or language there, write it down right away when everything is very fresh in your mind, and make phone call to call the police. Even at the moment, you may not sure if this incident is in the level to be defined as hate crime, but still call 911 right away, because every phone call will be recorded, and every record will help the administration and the law enforcement to know what's happening on the ground and help them in the long term to frame their structure, to frame their service, and help them to allocate the resource and their work, manpower, which deserve for our community. And this, I'm sorry, I want to ask everyone just once a quick guess. Throughout the past 1 year, which means literally from the beginning of the pandemic until now, at least like 2 weeks ago, how many hate crime report related to Asian community have been reported to the police department of Philadelphia? Just guess. Now I can only see the video of panelists here. Can you raise up your finger or type on the number or say 5 means 50 or 500?
5.
5. Oh, that's very sad and small. What does it mean?
0.
A little bit better than that, only 3, believe it or not. And Chinatown, how many cases? Guess, the Chinatown in Philadelphia, 0.
0.
And among the totally 3 cases reported to the Department of the Philadelphia, among 3, only 1 so far have been defined as racial motivated crime. So it's very important to report, because we know those things happen on the ground almost every day. And there are multiple reasons for the reluctance and the fear of reporting, but we have to start taking action and make those recent people accounted, and yeah, try to report and spread the word, encourage ourselves and everyone among us, especially starting from adults. think about how your kids are feeling in the school. Many kids have been reaching out to us to tell us they feel very isolated, very lonely, ignored, and even bullying and by their classmates, even something from the teacher. But even they feel hard to speak to their parents. Think about when something happens in front of the adult, when the adult still stays silent, not saying anything, no matter as a victim or as a witness, what is the message to our young generation? So it's just for our challenging situation today and for the future, and even the future safety for our kids, we have to make change from now and take action together.
Thank you, Stephanie. I know we're getting closer, but there's one very important question remain for Congresswoman, for you and David. Maybe Stephanie, you could jump in as well from the governor's side. How do you go about vaccinating undocumented or so-called illegal immigrant? Even though that this vaccine have no borders, at least that's what I like to believe, but there people might be afraid to go on site, right? Or if I've been helping people with limited English skill or another skill vaccine to schedule, but they might not feel comfortable entering their information, right? Or they might be in the fear that, okay, what if you go on vaccine site and the eye shows up? If you could please clarify or comment on that.
Yeah, I think there's both kind of the legal and then the practical aspect of this. I mean, we were very clear throughout this pandemic to make sure that the vaccinations and testing would be available to everyone without charge, because that's the public health way you have to do it. So that's why we passed legislation to fund testing, to fund vaccination, so that people wouldn't be deterred from doing it. And it explicitly did not refer to people's status in the US. Because germs know no borders, as well as, humanity. But we have been very concerned, just knowing the way the world operates and the tensions that we've seen over the last 4 years, where the immigration situation has really been weaponized, that people would naturally be fearful. So that is why we are trying to get out into the communities using the trusted messengers, similar to how we tried to do it during the census. And in fact, in Philadelphia, they're using some of the census folks as well to get the message out. I think one thing that is going to help that a little bit as we move into this, as we get that 1-dose Johnson & Johnson vaccine, that will help overcome some of this, because people only have to go in once. They're not going to have to go back a second time. So I'm hoping that will relieve a little bit of the anxiety. If we were to ever hear of that happening, I would please ask people to report it to me, and we will investigate, because that is just wrong. That's just flat out wrong. It's not supposed to happen. You're not supposed to be using border enforcement or enforcement tactics when someone is getting medical care that is for the good of everyone. So I would certainly want to hear about that. It is not supposed to be happening, and we would definitely push back.
And not much to add to that other than to concur. We really do need folks like yourselves to get the word out that that is not something that will be tolerated. And it should be reported if there is anything like that going on, so we can address it. I've not heard anything to that effect. But we should be vigilant, like all the things that Stephanie has spoken about. We should, in regards to reporting, we should be vigilant. And if we see something like that, we should report any issues along those lines. But I think getting the information out that it's not, there should not be any of those kinds of issues, that plans have been put in place to avoid those situations. To me, that's the message that should go out.
brothers, and I just wanted to add something because I know this, just an important point was risen here. I remember how we could really convert our adversity into empowerment. I remember when 9/11 happened and the Islamophobia was on its verge. I can tell you what helped my children to sort of, secure themselves against the Islamophobia is that, I mean, as a parent, I used to go to their schools, to their class, and read them books about who Muslims are, what we stand for, so that it could help them like define, like really show who they are rather than someone else defining them. I texted Brother Rabil. It's like a link to the Google, and I think maybe if we could tell parents of Asian descent to their children is to read these books to their children's classrooms, teachers, and peers, and educate and use this as an opportunity to not only educate them about the virus in itself, but also to remove that stereotyping of our Asian brothers and sisters. I think it is an opportunity to make a change for good.
Thank you, Dr. Najman. I'll share it in the chat here. And Stephanie, not sure if you had anything, or if not, we'll go to Pastor Nate. I think he has a question.
Yes, I do have a question. Thank you. And I really appreciate this conversation today. I hadn't expected to spend a great deal of our conversation on the hate. So, Mr. Sanders, thank you for at least starting that conversation. Thank you. My question has to do, Congresswoman Scanlon, with the SARS Act, the legislation that's supposed to be distributed into our communities to kind of help us get through this pandemic. You talked about the rent, and I'm as a minister, I'm particularly interested in the part of the act that deals with funerals. I don't know if that's something that you would be able to, and I hope that I didn't put you on the spot.
Nope.
But that's been a question that I've been asked over and over and over again. And if you could help me with that, I would appreciate it.
Surely. So this is something that's we've been advocating for since last March, and it was actually initially proposed by a young congresswoman you might have heard of. Her name is Alexandria from New York. New York was hit very early, and the situation there was really dire, with hospitals, funeral homes, everything being overwhelmed. There is a history in our country of, at a time of natural disaster, for FEMA being able to provide funeral expenses for folks who can't afford it. And so a year ago, Representative Ocasio-Cortez proposed that that our COVID relief bills start to have that kind of FEMA relief to help people pay for the natural disaster of the pandemic with respect to funeral expenses. It had not made it into final legislation until this most recent bill in March, but it is part of that bill. And I think FEMA has just started to issue how that money is going to be accessed, like in the last week or so. So if you can't find it on the FEMA website, please contact our office and we'll get you that information. But that is something that's kind of been in the works for a while and finally came through.
Thank you. Thank you very much.
Sure. Mm-hmm.
I just posted the link to FEMA's website.
There we go.
And I think on April 12th, they are starting processing the applications. We also sent a note to our congregational list, and I know that it's very much needed across the spectrum. Pastor Nate, thank you for uplifting that aspect. There are many resources like this. I think if we do not message enough in the big net of information, sometimes it gets lost. So definitely, like our political offices, our congregational leaders, nonprofits amplifying is really critical. Brother Rabil, over back to you.
Yeah, thank you, Ahmed, for sharing that link. I also shared the link that Dr. Najman was talking about the book. And I also shared the video that we have launched, which has over 1 million views by now in 8 different languages about the vaccine hesitancy. Feel free to share that as well. With that, I just wanted to ask all of our panelists if they have anything else to share, any final remark, maybe from Congresswoman Scanlon, a remark from you.
I just want to thank you all for participating today. It's so helpful to use every avenue we have to reach out to our very diverse communities, and I really appreciate your including me today. So again, if if anyone has follow-up questions or anything, you can reach me through our office, which is at scanlon.house.gov. And you can call at 610-626-2020. And thank you again.
Thank you so much for joining Congresswoman Scanlon, and we look forward to the partnership. Maybe a few words from you, David.
Sure, just that, you know, as a director of the Office of Health Equity, my concern is focused in on those that are considered vulnerable communities and individuals that speak different languages than English would fall under that. Immigrants and refugees would fall under that. You know, low income. So they know that you have a friend at the Department of Health. There's a lot of folks that are really interested in serving those that need the most help. So whatever I can do, folks know how to reach me. You have me here, so you know how to reach me in the future, and I'd be more than happy to help. Thank you. Thanks for having me as well.
Thank you, David. Dr. Najmun.
Yeah, Brother Bill, just two things I want to mention. One thing is for parents out there, if you notice any psychological symptoms in your children, then please don't think that this is going to pass and it'll be, you know, gone in a little bit. Please have them either talk to their pediatrician or just a local counselor. And number two is that coronavirus also has some real psychiatric symptoms which happen, which are physical symptoms. And they have seen that they've been coming up after 6 months of getting the virus. So if you're noticing any decreased concentration, depression, anxiety, then kindly go seek help for that, and should not really ignore it. And just the third point I wanted to mention for our minority people, African Americans, Hispanics who are not ready to get the vaccine, kindly just ask them questions as to why. Just keep asking them questions instead of forcing that, no, you got to get this shot. So something interesting might come out after you ask them those questions. And that's about it. Thank you so much.
Thank you, Dr. Najmun, and thank you for being an excellent volunteer of MAI as well. Stephanie, a few words from you.
Thank you. Instead of a remarks, I just want to add something to your question about the language access to the vaccination. We have been working very closely with diverse community in different regions across PA and team up with multiple government agencies, including the governor's vaccination task force, to address this issue. So for example, we have been supporting the city of Philadelphia on building the strategy on engaging the Asian Pacific American community. We co-organized a vaccine community education program named COVID-19 Vaccine Campaign Training to equip and empower community trusted messengers and leaders to share the information about the vaccine, as well as the critical public health guidance with their families and neighbors and community. So the vaccine champions, after the training, they will be able to accurately answer questions about COVID-19 vaccine and promote the vaccination within their communities. We had the first round of the training in 3 different languages, including Mandarin, which is the most spoken Asian language in Philadelphia area last month. And we will have the second session of training on the coming Wednesday. I will share the information with you and you can share with the community. And we have also been working on different ways to get the messages out to diverse communities. For example, we have been working on the multilingual SAP video program, inviting community trusted messengers and medical professionals to make video to talk about the accurate information on vaccine in different Asian languages. We're so grateful to your organization even have done it already. Thank you. And we will also continue use the paid advertising resource for diverse ethnic media to serve the low English proficiency community. And I strongly agree with all the panelists their comment on the reasons for the vaccine reluctance. But think about it, in the immigrant community, the language barriers and information barriers even give more room for misinformation. So we really need to combat the misinformation together. Thank you.
Thank you, Stephanie, for joining today and for your partnership as well. Pastor Nate.
Thank you. Just two quick things. First of all, I want to thank the Muslim Aid Initiative for the work that you're doing. It's fantastic. And just to be a part of this forum this afternoon has just been great. The second thing is I want those that are listening in our community to know that I'm working as hard as I can to get another vaccine site in the Upper Darby Bywood area. I'm just committed to do that. And I'll end by saying that in December, my brother passed away from complications of COVID. That just galvanized me to make sure that as many people as I could to get this into their arms, that I would do that. I don't want anyone to suffer the way my brother did. And so that's my motivation for doing this. Thank you again for having me.
Thank you, Pastor Nate. And last but not the least, our rock star, Dr. Starwani, I was going to say, but Arshad Wani. Final note from you.
Raviul, I thank you so much for this. I just really thoroughly enjoyed this whole discussion and just the structure of this meeting. You can imagine it's not just people from one field. I can tell you this COVID, we can't get rid of this. It's not just the healthcare workers' job or the job of the Department of Health. Like you can see here, our politicians, our representatives, our pastors, our imams, religious leaders, because eventually it's going to fall on those people who are underserved and who are not represented well, who will need to be vaccinated. And I think that's the way to get to them. And I would say just part with this message to everyone that we're so close to winning this, battle that just do not prematurely, lose all that we have done all over this, the almost and most of a year now. Just because we're there close, let's not lose this. Let's just be patient, just wait a little bit more. And to those people who are still on the fence, I think I just tell them, like Najman brought up a very good point. You don't have to just counteract people with your own beliefs and say, why are you thinking like this? Instead, you have to ask them why they think like that, why they don't want to be vaccinated, and try to explore what are the things that they're worried about, or they may have genuine concerns about, not being represented well in these studies, or, past experiences that, prevent them from getting the vaccine, but also encouraging them to look at, websites and at information which is genuine. Because when on the website, on the internet, you type something, there is half of the websites are which might have a lot of misinformation on them. So going to CDC websites, so going to the Department of Health website, or we have so many educational and medical institutions in the city, or even going to your own community website. We have MAI website. So, things like that, just good education. I think it's all of our responsibility to give good education to people we interact with to win this battle with the COVID, infection together. Thank you.
Thank you, Dr. Wani. Anything from you, Brother Ahmed?
I'll only thank you all and all the other 20 or so, I think, organizations that supported this program for their support. I only wanted to uplift the voting process for this year. There is local municipal elections, critical races from school board members to judges who have an impact and consequence on many of the subjects that we are talking here today. And I posted our Rock the Vote platform link, pa.care.com/vote, where hopefully our community members will choose to be registered. If they are not, before the May 3rd deadline for voter registration, I will vote in the primaries on May 18th.
Thank you, Brother Ahmed, and everyone. And quick remark from my end. Recently, I received both doses of my COVID vaccine. I would urge everyone to get it as soon as you have the opportunity to. Definitely, we're getting close to defeating this virus that has taken our lives and disrupted it. As Dr. Wani mentioned, right, there's no difference between brands of vaccine. They've all been approved by FDA after careful consideration of results, and they're all equally effective against this virus. I would encourage everyone to join your millions of friends and citizens in this vaccination effort to put an end to this pandemic together. With that, I would like to thank everyone and our partner. I should mention a special thanks to Pennsylvania Department of Health for their continuous support, as well as Stephanie, you and your office, Care Philadelphia, Engage, Einstein Health, Manufacturing, Biode Association, Hope Foundation, Engage, and many other partners who have supported us today. Thank you so much to all of you, and thanks for joining us today. Thank you.
Thank you.
Thank you.
Bye.
Thank you.
Have a great evening.